I'd like to call Christopher Williamson from Emory up to the podium. Christopher is going to be talking about implementing a flipped classroom concept for radiation oncology physics curriculum. Welcome, Christopher.
Thank you. I'm a walker or pacer, so hopefully they'll be able to hear me if I walk around. Thank you for the introduction. I'm a PGY4.
Why don't you use this? If you're going to walk around, it's because you want.
I'll just stay there.
Okay. Well, we want the online people to hear you right now.
I'll make sure I stick around. Okay, I'll keep it easy. Thanks for the introduction. PGY4 in radiation oncology at Emory. I put a lot of letters after my name just to give props to my roots as a medical physicist. I'm retired now, but for the 10 or so physicists, I haven't forgotten. But it put me in a unique position to help with this project of implementing this flipped classroom concept. So what I'm going to talk about, I'm going to give a brief overview of the flipped classroom concept as well as active learning, the Emory experience, as well as some resident feedback and future implications. So overall, residents do a pretty good job passing the ABR board exams on the first attempt, greater than 90% nationally. So as educators, it's like, what do we need to do to make sure it's not a cram session, just study it, dump it and forget it. So we want to make sure they have a firm foundation in physics so that they're good radiation oncologists. And interestingly, when we were doing this project, concerning the residents' needs, the AAPM and ASTRA kind of came out with this paper talking about how the physics curriculum should be better aligned with what the ABR study guide kind of put forth. And it's not necessarily teaching to the test. It's more focusing on like the high yield concepts, what they feel that radiation oncology residents should graduate with as a firm foundation for their future career. And I think the next talk is going to go into that a little bit deeper. So in order to do that, we came up with this, we didn't come up with it, but this idea of the flipped classroom where we provide educational materials to the residents or the students ahead of time. And then we use the in-class period and using this active learning concept where we engage the residents, whether it's questions, working through questions, group discussion, open discussion on the material, and let them consolidate that information and take home and kind of assess their own understanding. So active learning isn't new in the educational realm. This is actually a really good study out of Harvard that did active learning versus passive learning for high level engineering courses, which is important for us because physics is a high level content course. And the big takeaway from this is if you look at the columns on the far right, it's called the feel of learning. How did the students feel they were learning? Did they like it? Spoiler, they didn't. Active learning, the students thought that the educators didn't do a good job. They didn't like learning that way. They didn't feel they were learning that way. However, when you look at the far left column, they actually performed better on tests. So this was just a good study that showed that active learning, even for high level education, is effective and benefits the students, even though they may not like it. So at Emory, what we did is we implemented this flipped classroom for the first 6 of our 32 lecture series. We provided these bite-sized educational material, whether it's previous lectures, short bit lectures, or questions. We gave them to them on Monday. So we gave them a week to prepare for the Friday session. And then we promoted this active learning concept using ABR-styled questions embedded in our lectures using Pull Everywhere software. And then afterwards, we did this 5-point Likert scale to kind of assess how the program was rolled out, how it was implemented, and if it covered the content that the residents felt was useful. So the main thing with flipped classroom is it hinges on the fact that the residents are actually able to review the material prior to the classroom session. Priority as a radiation oncologist or oncology residents is the clinic, okay? But we were actually pretty pleased the fact that even a neutral response was pretty good, that they felt they had the time to review the material, and not only review it, they felt they could understand it as well, reviewing it on their own. So this was the active learning portion of the flipped classroom concept where the students would log in using the QR code at the top right on their phone. We made it anonymous at the very beginning so that it encouraged this positive environment for engagement. Students didn't like, that way they didn't feel they're going to get dinged if they got it wrong. And then we would get real-time feedback on the distribution of answers, whether the residents were understanding concepts or not. And then after we would do this, we would actually review the content and why the questions were right or wrong, or why the answers were right or wrong. So overall, the classroom experience was very positive. The residents felt that it was a positive environment for resident engagement. The lectures provided explanation of the topics discussed. The questions during the lectures did help reinforce out-of-class materials, and the physics faculty did a good job covering the content. Now, when you do these surveys, you never want to see a disagree. This was a learning curve for the educators as well on how many questions to put in the slides, how much time to spend on the content, and also kind of going back to that Harvard study, the feel of learning. You know, this is something that type A personalities or people that are really want to get the questions or the answers right, when they're put on the spot and they might not get it right, you know, it's just kind of a uncomfortable situation. And then the big takeaway from this is the post-classroom debrief. Overall, very positive response. The residents felt more comfortable in the physics material after this. And then they also felt that after reviewing the out-of-class material and participating in the lecture, they could retain it a lot better. And so where do we go from now? So future applications for this is the data collected during these active learning sessions can actually be used to assess the residents. Having them log in as their own username will allow us to kind of track their progress, see if there's any deficiencies or difficulty understanding content. And it also allows the physics curriculum to be adapted a bit, meaning that if maybe we could spend more time on high yield content or difficult content, and maybe not so much on the low hanging fruit. And then longitudinal aspect, considering like the spaced learning concept where we can, like very similar to CME style questions, we would do 1 or 2 questions a month to review or to revisit previously covered material, just to make sure it's fresh in their brain so they don't feel they have to cram for in-service exams or even the board exam. And then possible implementation to the other resident didactics, whether it be rad bio or clinical didactics. So in summary, active learning has been shown to improve student performance. We've had positive feedback with the Emory experience with the flipped classroom concept. There's a possibility for resident assessment and curriculum thinking and longitudinal application for continuing education, and as well as implementation and other resident didactic sessions. I'd like to thank the Emory staff. They worked really hard to implement this and kind of update their slides. Special acknowledgement to Marion Exente. He's a very champion for education, and he was the one that kind of spearheaded this project.